what section of HIPAA
Any
forbids you from?
personally identifiable information. So when you have a small number of cases, if there's only one 17-year-old, for example, who tests positive for COVID-19 and your next door neighbor has a 17-year-old who's homesick, you might connect the dots and say, oh my God, this person has COVID-19. So
So
we
it's
just
the
want to
sample
avoid
size
that.
of positive tests versus the
Yes.
sample size of a city, a large city.
Yes.
It's not fair to
Right.
release an age.
Exactly.
Okay.
Exactly.
And then can we clear up? BAMC has pushed back a little bit. They claim the woman who died Saturday was not a BAMC patient.
Yeah, but Jeff's
So-
got all of that we have agreed between BAMC and the city. So are we releasing a written statement about that?
Yeah, which I can send to you.
Yeah,
Okay.
we're on the same page. There was some parsing of words, but we are on exactly the same page. We are jointly issuing a written statement that clarifies everybody's facts.
Okay. And you don't intend to give us the names and ages even when they pass away for the woman who died Saturday and moving forward?
That's not at the top of my priority list right now. We need to talk that through, and I need to think that through. But right now, no.
Okay.
No. That's what I told somebody today. That's not on my top 3 problem list, so that goes to another day.
Yeah. We just, from the media perspective, if a person is shot in a drive-by shooting and dies,
Yeah.
we're able to get the age, the name,
Right.
date of birth even, and we're just curious as to why this would be a special circumstance.
Mainly just because we need to make sure that we have all of our I's dotted and our T's crossed, and we're all running on maximum capacity right now, and so we're having to prioritize the work we do to help the people know what they need to know about COVID-19, understand where they can go to get tested, have the physicians understand what to do and how to make that work with the mayor's office on anything he needs. So there are a lot of things that we're trying to respond to right now, and we're trying to prioritize those responses.
Okay. And I'll just go down the list of questions that I was
Sure.
given. These JBSA figures that come out in terms of positive tests, number of tests done, are those included in the Metro Health figures that are posted online, or is that are they responsible for their own reporting?
So there's 2 kinds of JBSA data. One is Lackland, which has the federal evacuees. That is not included in our data because those aren't Bexar County residents. Those are folks from other places in Texas or other states. So that information, those numbers have never been included in our Bexar County specific data. JBSA and BAMC, as they test individuals and identify them as being positive, if they're from people who live in Bexar County, they are reporting that information to us, and that does get included in our report.
So the 45 positive
Includes
like the
JB
person
from
Randolph
BAMC.
that had it?
Yes.
Okay. I was told, this was someone from the fire department, that there's not a shortage of tests or kits per se, but certain equipment like test tubes, culture dishes. Can you talk at all about that?
So that was true 2 days ago. It's not true now. We received a federal shipment. We actually received it on Friday. We had to unpack it and then assemble everything, and then learn how to run the new tests that they sent us. That was done on Saturday. Our testing was up and running again on Sunday, and we did 130 tests on Sunday, and we're operating at full capacity today for testing.
Okay. And how many counties does Metro Health test for?
So it says on the website it's 35.
I don't know. It does say it.
Yeah, so there's a little disclaimer underneath the
Is it
first
Region
chart. It is Region 8.
Okay, so I think
Yeah.
it's like close to 30.
Yeah.
So we can use the DSHS map for Region 8. That's an accurate depiction of.
Yes, and let me clarify that. So our lab processes the tests for Region 8. So that doesn't mean that Metro Health staff are out in other counties collecting those tests, but when state and local health officials in those counties collect the specimen, They then ship it to our lab, and our lab runs those tests.
So when we've seen positives in Comal County, Kendall County, those were tests that were done, those were processed by Metro Health and then given back to the counties to report?
Yes, that's one scenario. If the test was done by a private lab, for example, then that test is run by that private lab. So if it's processed in a public health lab, then yes, that's processed at our facility, and we report those results back out through the region.
Okay. Are the major hospitals now testing? Can Methodist now do its own COVID-19 test and then get results?
They can. There's still less availability of tests than would be ideal. And so we're working closely with the hospital systems to help them understand how to refer to the pre-approved testing site that we have operating at the Coliseum.
Okay. And then just the last written question, I think I have one more follow-up. What part of HIPAA specifically would be violated? You said it's just, the age of a patient is personally identifiable, so it's the bottom of page 3.
It's personally identifiable information with a small sample size is what we're dealing with here. So that's why we're not releasing that specific patient-by-patient information.
And I know it's fluid, it changes by the hour. What are your 3 priorities right now? You mentioned that when you walked out.
So our 3 priorities are to stop the spread of COVID-19. Anything we can do by helping people understand the mayor's order, the governor's order, the president's order, help people understand, how they can still go to a park as long as they're practicing social distancing. That kind of education is our first priority. Our second priority is making sure that our healthcare system has everything they need to continue to operate, because that's what we're seeing in other places that are dealing with this, that are farther along, is that the healthcare system starts to be stressed a little bit. So we're trying to stay on top of what the hospital systems and our healthcare systems need in order to continue to care for patients who need it. And then the third priority is trying to figure out how, we'll just call it communication, keeping everybody in the loop on the latest information. We're doing a daily press release, we're doing a daily update to the mayor and council, we're doing twice daily updates to executive leadership team. So just that communication, making sure that we all have the same information, that we're communicating it consistently, and that through this sense of kind of proactive communication, we're alleviating some of the anxiety that can occur when you have information gaps.
Okay. And where are we at with the hospitals? Do they have everything they need right now?
So hospitals are, they are okay right now. What we want to do is make sure that we have multiple contingency plans in place so that if one system gets stressed, the others can help out. That's what's so wonderful about having STRAC and MedCom, is we're used to doing that anyway. This is just on a bit of a bigger scale. But yeah, they're okay right now.
Is this the biggest challenge you've ever had as a health professional? This
is by far the most complex pandemic I have ever been involved with.
Okay. I think I'm good, unless we didn't touch on something that you think they're going to use this
good.
probably multiple shows.
No, I looked it up. It doesn't say the number.
It doesn't?
It says a part of the laboratory response network.
Okay.
I guess the follow-up is that the mayor on Saturday evening said that he was going to start including the private lab tests. Because that's the number one question from the public is how many people are getting tested, where are they being tested? And so when are those numbers going to be included?
They are. They had that conversation today. So there's a testing task force that meets every other day, and the private labs are part of that testing task force. And so they had a pretty in-depth conversation today about what that process looks like for those private labs to send to us the number of negative tests that they're doing. We're already getting all of the positives. We just want to get the negatives so that we have a complete picture. And they had a great conversation about that today, and they're figuring that out.
And when are the latest numbers going up?
4 o'clock.
4 o'clock?
Yep.
Great.
Do you want to touch either of the two sort of misconceptions we were talking about, the masks issue and
Sure.
Sure.
who needs testing?
Sure. So one of the questions I get a lot is, should healthy people be wearing masks? And the simple message about masks is that masks are worn by sick people to protect healthy people. A healthy person wearing a mask is not going to stop them from getting infected because they haven't covered their eyes, they haven't stopped touching their face, et cetera, et cetera. So the simple message here is sick people should wear masks to protect healthy people. And because I know that, when I see somebody out and about with a mask on, I assume that they are sick. So we need more consistency there, but masks are not going to help healthy people avoid getting infection. So that's masks. And then
And real quick, I mean, I just got an email before we walked out here from a state rep's office saying we're getting tons of requests about how we make masks at home and all that, which is
yeah.
Do you even want people doing that?
No, not at all.
Okay.
It's not effective.
I can't make an N95 mask.
No, you can't.
Yeah.
And so any other thing is almost a false sense of security, and that we're not looking for that either. The best thing people can do is to continue to wash their hands, keep their hands off their face, and stay home if they're sick. The other issue
the other thing
was
the testing that
the
for most
testing,
people,
yeah.
the test doesn't make a difference in how you respond to it.
Yeah, I guess everyone wants to get a test done.
Yes.
And that.
So a couple of things about testing. One, if you're not symptomatic, the test isn't going to tell you if you've been exposed. The test only tells us if the virus is active in your body. So you have to have symptoms before that test will work. The second thing about testing is so for example, if you had the flu, you knew you had the flu, not everybody who knows they have the flu goes to the doctor's office to get a flu test to verify they have the flu. There's no requirement for people to get tested for COVID-19. It's another virus like the flu where if you're okay staying at home, taking care of yourself, taking Tylenol, getting plenty of rest, drinking plenty of fluids, then that's okay. People don't need to feel obligated to come out when they're not feeling well and get a test. On the other hand, there are plenty of tests available. We're not restricting people from getting tests if that's what they need to do. So that's the message that we're trying to get out there. Nobody's obligated to get a test. If you have symptoms and you're worried and knowing for sure will make you feel less anxious about it, then contact your healthcare provider. They know how to make the referral to the pre-approved testing site. We have plenty of tests. We can get people tested.
Okay. And then again, the city has no intention to release the names and ages once someone has passed away from COVID-19 complications.
Today, no. We'll put that on the secondary list of things to fix, but right now we're dealing with a little higher level stuff.
Understood. Thank you so much.